I'm Dr. Charles Serrurier, and I'm an oncoplastic surgeon based at the Rosebank Oncoplastic and Cosmetic Surgery Institute, or ROCSI as we call the unit. ROCSI is a multidisciplinary breast and cosmetics unit, and the main focus of ROCSI is the holistic management of breast cancer patients. The secondary focus is obviously the cosmetic patients, but primarily I've designed this unit to take South African breast care management into the next century and align it with the way breast cancer is managed in the first world, predominantly in Europe and the UK. So ROCSI is based in the Medical and Dental Centre here in the leafy suburbs of Rosebank, directly across the road from the Rosebank Hospital. We have access to all our theatre facilities and the MRI facilities of the hospital, but we have our own preferred screening unit, which is called Breast for Life, which is adjacent to the unit on the first floor in the Medical and Dental Centre. At ROCSI, we've designed the unit to be as welcoming and as friendly as possible. The journey through the unit will be guided by Liza, who is our patient navigator, and she will hold and manage the patient in every respect of their journey through the unit. Here at ROCSI, we have a world first. We have a day diagnostic clinic. That means we are able to provide a patient with a diagnosis of breast cancer, yes or no, within the same working day. How it works is the patient would be referred, they would be seen early in the morning, they would pop across to Breast for Life for the appropriate imaging and a biopsy if felt necessary. And with the services of QLab, we will be able to run the specimen within the course of the early afternoon, and by 4 o'clock in the afternoon we will know whether that mass is a cancer or a benign mass.
My name is Dr. Christopher Maskey, and I am a pathologist, and I am involved in the laboratory diagnosis of cancers and other diseases. So what I do is I come and sit with the surgeon in the operating theatre or in the procedure room, and as the tumour is cut out, I evaluate that immediately to check that all the tumour is cut out. If not, we then direct the margins to complete the resection so that when the last stitch is put in and the patient goes home, we know that that tumour was completely excised and we won't have to come back again after.
Diet, exercise and well-being are fundamental aspects to the patient's recovery. A healthy, balanced diet will provide the patient all the nutrients they need to combat the side effects of their potential chemotherapy, but more importantly, provide the right nurturing environment of the body so it will heal after surgery. In the last year and a half, I've been very fortunate to treat many patients through the ROCSI unit. One of my very fond patients, Marisa, would like to share a couple of thoughts about her experience through the unit.
My name is Marisa Lowe, and I'm a patient of Dr. Charles Serrurier. Dr. Charles and his multidisciplinary team have really been looking after me over the last 19 months. They are caring, they are professional, and they are specialists in their field. I felt cared for and loved with each visit, and the support and the advice that he and his team has provided really helped me to make the best decisions for what I want for my treatment. I was looking for a doctor who would listen to my needs, who would take my lifestyle into consideration, and that is what Dr. Charles and his team did. And I will always be grateful for them for helping me to get through what for me was one of the worst things that could have happened to me in my life, to get diagnosed with breast cancer. So Dr. Charles and your team, thank you very much. I will always remember you for that.
The logo of ROCSI is the baobab tree. The reason why we decided on that is that it is central to the genesis of Africa. Some of the baobab trees in Africa are over thousands of years old, and it provides a central pivot point to every African community and is known in Africa as the Tree of Life.